Hello, everyone. Good evening from Manila, and good afternoon, good morning, wherever you are in the world right now. Again, welcome to Session 6 of the Southeast Asia Climate and Health Responders course, brought to you by the Global Consortium on Climate and Health Education, hosted by the Columbia University Mailman School of Public Health, the Planetary and Global Health Program of the St. Luke's Medical Center College of Medicine in the Philippines, and Healthcare Without Harm, Southeast Asia. I'm again Dr. Renzo Ginto, the director of the Planetary and Global Health Program, and as usual, I'll be moderating today's session. Kind reminder to all our co-learners in the Zoom, please keep your microphones muted, your cameras off, and please use the chat box for your questions, comments, also for sharing information, materials. Over the past 5 sessions, we have seen a tremendous level of energy and activity in the chat box. And so I hope that we can keep that level of sharing and contribution and participation, including in this session, which will focus on climate-smart healthcare, mitigation, and sustainability. I hope that you remember during my presentation in the first session, I introduced to you the concept of climate-smart healthcare. Climate-smart is the convergence between, on one hand, sustainability, mitigation, making sure that the healthcare system is environment friendly, environmentally sustainable, low carbon, green. So those are all the terms that you will be hearing a lot when we pertain to the concept of sustainability. And on the other hand, climate smart healthcare also pertains to resilience, adaptation, making sure that the health sector is responding to the health effects of climate change, that we continue to operate and deliver the health services that the health sector that we are designed to deliver and to achieve. So in this session, we will be talking about that first part of climate smart healthcare, which is mitigation and sustainability. And today we are very privileged to have with us our speaker who will be talking about this important subject. He is Mr. Ramon San Pascual, MPH. He has an advanced training in public health from the University of Washington in the United States. He has a long-standing career in public health advocacy. You've heard him speak during our first session where he talked about his numerous involvements in reproductive health, in health legislation, in public health, and of course, in climate and health advocacy. He is the executive director of Healthcare Without Harm Southeast Asia, which used to be my former employer. That is one of my former stints. I had the privilege of helping establish the climate, health, and energy program of Healthcare Without Harm here in Southeast Asia. And until today, I'm a very proud friend, consultant, and ally of this wonderful organization that has been leading the global health sector in addressing climate change and all other environmental health threats. So we are very, very pleased to have Mon, a friend and a comrade, to be delivering session 6 on health sector mitigation and sustainability. Mon, I give you now the microphone. Thank you again for joining us. Mon, you are muted.
Thank you so much, Renzo, for that wonderful introduction. Let me first share my screen as I greet good evening to all the learner participants who've been here across sessions. This is now session 6. And I am assigned to deliver the topic, Part 1, as mentioned by Renzo, on climate smart healthcare, focusing particularly on mitigation and sustainability. By next week, a colleague of mine, Jit Sohal, will also tackle the part 2 of this session on adaptation and sustainability. Now, for my session this evening, and let me do this, I hope, in the next 30 or so minutes, I will cover the following topics. One, the very concept of mitigation in healthcare. Second, I will present the roadmap to healthcare decarbonization that was also produced by Healthcare Without Harm quite recently. And then I will speak about the set of hospitals, a large network, global network, that champions climate and health, both mitigation, adaptation, and leadership. This is the Global Green and Healthy Hospital Network. And then I will go quickly on some of the measurements and tools being utilized, not only to measure, but also to actually measure the reduction in carbon emission in healthcare. And then I will go over some case studies and actual examples of hospitals, but highlighting particularly, I mean, I'm so grateful to have here in this session, Sister Arcelita Sarnilio, the director of St. Paul Hospital in Iloilo City in the Philippines. Again, I'm Ramon San Pascual, and I'm just grateful that I have you in the next 1.5 hours for this important discussion on climate mitigation in healthcare. Now, what do we talk about when we mention the term climate mitigation? So I borrow here a definition from the IPCC. Climate mitigation is any action taken to permanently eliminate or reduce the long-term risk and hazards of climate change to human life and property. It is an anthropogenic intervention to reduce the sources or enhance the sinks of greenhouse gases. The term anthropogenic, and I will explain that later. Why is it important to pursue climate mitigation in the setting of healthcare? It will produce resilience in the health system. And a climate resilient health system is one that is capable to anticipate, respond to, cope with, recover from, and adapt to climate-related shocks and stresses, which will mean improvement in health of the population despite the unstable climate. You would note there that that climate mitigation is human caused or anthropogenic. And yet, there is the theory of anthropogenic climate change, which means that humans are the ones causing most of the current changes to climate by burning fossil fuels such as coal, oil, and natural gas. The overwhelming majority of climate studies indicate that human activity is causing rapid changes to climate, which will cause severe environmental damage. In fact, there is a strong scientific consensus on this issue, such that study after study published in peer-reviewed scientific journals show that 97% of climate scientists agree that climate warming, climate change, and global warming is emanating from human activities. And yet, the climate mitigation is also a set of actions that should be taken by humans. So we cause the problem, but we should also provide the solution in an active way. Now, Renzo mentioned already at the beginning what climate smart healthcare is, but since this is part of the title, let me just show you quickly this slide. This is from the research publication produced by World Bank, also assisted by Healthcare Without Harm in some of the research and write-up on climate smart healthcare. Now, the key elements of low carbon healthcare or climate smart healthcare include the following: a health system design and models of care that is based on appropriate technology, coordinated care, emphasis on local providers, and driven by public health needs. Second, it is a building design and construction that is based on low carbon approaches. It is also an investment program in renewable energy and energy efficiency. Another element is the deliberate effort to minimize waste in a sustainable healthcare fashion within the waste load of the hospitals. Another is sustainable transport and water consumption policies, low carbon procurement policies for pharmaceuticals, and resilient strategies to withstand extreme weather events. Now, such action is important for healthcare to take up. For one, because it also produces co-benefits in terms of healthcare, improving health status by reduction in environmental pollution and slowdown of the climate change, improve health system efficiency, and other positive outcomes for health and for society in general. Now, with that laid down, how do we understand the climate footprint of healthcare and what sort of actions do we need to take? This is another publication produced in 2019 with a very strong assistance of ARUP, who did most of the research and the projection, and Healthcare Without Harm. This is the Healthcare Climate Footprint Report, which shows that, and this has been quoted, I think, by several lecturers previously, that 4.4% of global net emission is produced by the healthcare sector. So we are a significant producer of carbon emission. And the countries that are the biggest ones are not necessarily found outside of Asia. Of course, you have United States, you have European Union, but China is there, then Japan, South Korea, India, and other countries. Now, why is this report important? First, it provides the most comprehensive global analysis of healthcare's contribution to climate change. There's no other studies yet along this theme. It provides a global estimate of healthcare's greenhouse gas emissions, as well as of 43 countries that it covers, that provide estimate and break down emissions of these countries by the source of emissions, scope 1, scope 2, and scope 3, which I will explain further later. The report examines how energy, food, anesthetic gases, and transportation contribute to healthcare global climate footprint. It identifies opportunities for further research and the methodological development that would support the healthcare sector's efforts to understand and address its own climate footprint. It also outlines a series of both international, national, and subnational policy recommendations and actions that healthcare can take as a matter of addressing the threat of climate and reducing its footprint. Now, what are the key messages from this report? One, as I already mentioned, we are a major emitter. If it is a country, the healthcare sector is the fifth largest country in terms of carbon emission. Now, when viewed from three scopes or the sources of emission, more than half of the health sector's footprint is attributable to energy use. This is an important message in itself, because that means that we need to address, which is the fourth one there, fossil fuel combustion, being at the heart of healthcare's climate footprint. And yet, the third bullet there is that we need to address the healthcare supply chain, since it represents a significant part of the entire emission of hospitals. Let me provide here an example. Anesthetic gases. The field of anesthesiology is a carbon-intensive specialty involving the routine use of inhaled agents that are potent greenhouse gases. These gases are exhausted directly to the atmosphere, contributing to global warming. Inhaled anesthetic agents have been estimated to be responsible for a range of 0.01 to 0.1% of the total global carbon dioxide equivalent emissions, contributing to global warming. Based on the atmospheric sampling of volatile anesthetics, their accumulation is increasing. So in the hospital itself, we are producing emissions that some of us may not be aware, but are highly contributing to our carbon footprint. Now, this is an illustration of the sources of emission from an organization. And this applies as well to a hospital. Scope 1, it means direct emissions from owned or controlled sources. In many ways, these are the company cars, these are the vehicles, the ambulances being used, and the means of transportation that is being used by the organization. So this is scope 1. Scope 2 covers indirect emissions from the generation of purchased electricity, steam, heating, and cooling consumed by the organization, in this case, our hospital. Scope 3 includes all other indirect emissions that occur within the hospital's value chain. Now, when we talk about emission, it can be in the form of carbon dioxide or the CO2, methane or the CH4, nitrous oxide or the N2O, and the fluorinated gases. Now, why is it called scopes? Why not groups or types of emissions? Well, the name came from the Greenhouse Gas Protocol, which is the world's most widely used greenhouse gas accounting standard. As the Greenhouse Gas Protocol itself puts it, developing a full emission inventory in an organization, incorporating scope 1, 2, and 3 emissions, enable these organizations, these hospitals, to understand their full value chain emissions and focus their efforts on the greatest reduction opportunities. On the greatest reduction opportunities, let me repeat that. Now, what makes up scope 1 in terms of the percentage against scope 2, scope 3 in healthcare setting? The emissions emanating directly from healthcare facilities and healthcare-owned vehicles make up 17% of the healthcare sector worldwide footprint. 17% of our emission comes from scope 1, from the cars and vehicles and ambulances that hospitals do use. Indirect emissions from purchased energy sources, whether it's electricity, steam, cooling, heating, it comprises another 12%. That is the scope 2, which means that the biggest part, the lion's share of emission in hospitals, 71% in fact, primarily is derived from the healthcare supply chain, or the scope 3, through the production, transport, disposal of goods and services, such as pharmaceuticals and other chemicals, the food that we serve in our cafeteria and deliver to our patients, the agricultural products that we also utilize, the medical devices, supplies, daily supplies, and hospital equipment, instruments, everything has its own carbon footprint. And put together the supply chain contribution, it is 71% in healthcare. So going back now to the term, where is the greatest reduction opportunities? That tells you now where to place scope 1, scope 2, scope 3 in the context of healthcare. So from this report comes out several action recommendations. First, with urgency, there is no point of delaying any further the reduction of healthcare climate footprint, but now. Whether it is on scope 1, scope 2, and scope 3, there are actions that are recommended. One, we need to decarbonize the operations within the hospital. Second, in terms of the energy that we use, health organizations should invest and advocate for decarbonization of local and national energy systems. And of course, on the 71% supply chain, we need to address and go to what we call in our programming in healthcare without harm as sustainable procurement in healthcare. It is an effort, a global work to decarbonize the supply chain in hospitals. Now, the other actions are health sector must support the societal transition to clean renewable energy. Again, we should not see ourselves as if we are an island separated from the others, but rather we are part of a big societal movement that should transition to clean renewable energy. And we should chart the course for zero emission healthcare by 2050, as the UNFCCC has been trying to urge countries to do. Make development assistance for climate healthcare, meaning whether it is from the multilaterals, from different aid agencies, bilateral aids, that should contain efforts to facilitate climate smart healthcare. Establish and implement government action plans for climate smart healthcare, and further research, particularly in the context of the Southeast Asia. There are too many things that we don't understand yet, and yet there are already over the years that I've been working on climate and health as the Executive Director of Healthcare Without Harm, there have been increasing research, documents, manuals, and other toolkit even on climate change and healthcare. But this should not stop us to understand further our own setting in the Southeast Asia through research. Now, this leads us now to the whole issue of how do we decarbonize? And this is where healthcare already in the period of pandemic released the global roadmap for healthcare decarbonization. It is the first ever attempt to chart a course to zero emissions for the health sector. It is a navigational tool. It is not an exact prescription, but rather it is a navigational tool for achieving decarbonization with climate resilience and health equity. And we honor the partnership that were done with ARUP, who help us in terms of technical modeling and projections that are all contained in this roadmap. The roadmap identifies how healthcare decarbonization, resilience, and pandemic preparedness can be mutually reinforcing and synergistic. Meaning it's not one over the other, but rather we build resilient healthcare as we learn the lessons of the pandemic, such that we are more prepared in the next global health emergency. But at the same time, we just don't leave out the necessity of decarbonizing our operations, including what we saw, the use of PPEs, for example, that contributed a lot in terms of its own carbon footprint and in terms of polluting our ocean. Now, the roadmap projects trends into the future and identifies key pathways forward. And the main messages that should be taken from this report is that, one, the health sector needs to exert its leadership to take on the climate crisis. We are not only talking of technical terms about adaptation and mitigation and resilience building. We're talking about the need to develop and scale up the leadership in every healthcare unit, from the regular ward to your administrative office, to the entire management unit in the hospital, to the entire health facility and the healthcare system. leadership should be expressed clearly to understand, articulate, and take action on on the climate crisis. That's the first message there. Second, healthcare can and must chart a course to zero emissions. Knowing, acknowledging that we live in a very unequal world. And again, this was highlighted during the pandemic, where some hospitals and health systems are huge climate polluters and others don't have and yet other people would just die because they don't have access to healthcare or even basic or a facility that does not have regular electricity supply, and many people don't have access to care at all. So when we talk about decarbonization, it must be in the context of achieving both greater health equity and climate justice. The third message there is that to get to this net zero and equitable healthcare would mean major transformation, both of the sector and of the society. Transformation on how the health is financed and delivered, transformation on how healthcare goods and services are manufactured, packaged, transported, and disposed of, or even reused, recirculated in a manner that we create the circular healthcare. Transformation along with the broader society's production and consumption of energy. So these are the three key messages to be taken out of this roadmap. And yet, it provides some technical understanding of how we can take intelligent, smart action on decarbonization. It recognizes that if the health sector around the world were to come together to address the climate crisis, then the healthcare itself can influence more than its own footprint. It can be a societal impact that we can create if healthcare takes leadership in addressing the climate crisis. And then the other is that the roadmap, in practical terms, provides a plan and charts a course to get a healthcare towards zero emission. And this will be illustrated in the succeeding slides. As I mentioned, you can download the entire roadmap and check out your countries. It has data for 68 nations. I think as I've counted, around 18 countries in the Asian region are covered. Now, apart from the fact sheet, there are already tools for partners among yourselves in the global network, as well as health and climate advocates, to engage policymakers and healthcare leaders to take action. This is the purpose by which this roadmap has been developed, to help us engage with our policymakers and healthcare leaders. Now, if we don't do anything between now until 2050, the health sector emission will even go up to 6 gigatons per year. This is staggering, and it is shameful if us who took an oath of doing no harm just let things happen that we are harming not only our people but the entire planet. And yet, there are ways to do this. And this is where the whole roadmap becomes useful for us in the healthcare leadership. The blue wedge represents the commitment made in the nationally determined contributions. What is an NDC anyway, or the nationally determined contribution? It is the climate action plan to cut emissions and adapt to climate impacts agreed on by each party in the Paris Agreement. We are, as countries, we are all required to produce our NDC and update it in every 5 years. So that's the first part there, that if we go by and align ourselves with the NDCs of all those that have signed up into the Paris Agreement, we will be able to reduce our emission by 70% in the healthcare itself. And yet, it's not enough. It's only 70%. So the next set of action is the red wedge, which represents the further or additional action that can be taken across the health sector to reduce emissions further. And later on, we will describe the pathways and the high impact actions that will bring us to this lowering of carbon emission in hospitals. And then, not yet still done, there are still things that can be done further, and this is what we call now as the uncharted territory, or the yellow narrow line here. This means that we need to understand, explore further, and deepen our actions to even reduce the emission further in the healthcare. And I will discuss this in the next slides. And discussing now the roadmap, this is where the heart is, based on modeling and methodologies that are described in this whole manual or roadmap. The roadmap highlights 3 pathways and 7 high-impact actions that are interrelated and cover the reductions required over and above the NDCs. So, for example, that was too fast. There are 3 pathways uh, uh, that can be tracked by healthcare organizations. The first pathway is what the health sector needs to do within its own operations, in its clinical services, in its facilities, in the way buildings are used and designed, in the way we segregate and manage our waste. This is part of pathway 1. The second pathway is what the supply chain can do, or what we can do to decarbonize the supply chain by making sure that healthcare products are least have the least carbon on it. The third is making sure, this is the third pathway, that the wider economy and society match the same pace of reductions vis-a-vis other sectors that are contributing big deal in emission, whether it is agriculture, the energy sector, the transportation sector, the building and infrastructure sector, because all this will influence the health sector footprint. Therefore, again, we should look out into our own actions as part of the global movement. And healthcare can make sure this happens by its own leadership. Now, let me bring you to the 7 high impact actions. The first there is on renewable. Since bulk of the emission of healthcare is from energy that we use, therefore, transforming to renewable energy is a necessary impact action. And will also bring the energy to facilities and communities who lack access to energy that cannot be reached by the regular energy grids. 2, buildings. Developing sustainable zero-emission buildings that are fit for purpose for healthcare in the 21st century is a cornerstone action. So when you see a hospital facility, a hospital building, a structure, do not just look at it as if it's just a regular structure. In itself, the very design and the way it operates, that building, contribute a lot, whether we reduce our emission or we contribute further and worsen climate change. Now, on the third, travel, this includes active and sustainable travel, as well as going to e-vehicles. On the cars that we use, for example, in the ambulances that are regularly serving clients or our patients, we can take active and sustainable electrification of these vehicles. Number 4, food that is local, sustainable, and plant forward. Again, this is sometimes ignored, how much emission is coming off from the food being served in our cafeteria. But I will take some examples later on in certain hospitals in Southeast Asia. 5 is on pharmaceuticals. This is a huge emission, 2.9 gigatons. Uh, this is one of the health sector very specific interventions, the way medicines are prescribed, not only manufactured, but it comes from the doctor, the way doctors prescribe, and moving over to greener pharmaceuticals and the infrastructure that support the manufacture, dissemination, and disposal of the waste from unused or expired pharmaceuticals. There are more on this, but let me jump to number 6. We need to pay attention to the products that are purchased. Wherever possible, medical products should be reprocessable or designed for reuse, that any leftover waste is managed sustainably by segregating it and recycling as much as possible. So waste is not only an issue of plastics pollution, it's very much an issue of climate change, as being discussed here. Many medical devices can be autoclaved safely rather than incinerated, and gloves are generally not needed for many procedures such as vaccination. Gloves is the #1 medical waste that are found globally, and it even become worse during the time of the pandemic. And these are plastics. Now, the 7th, there is effectiveness. What does it mean? It is a key such that whatever we do in healthcare, it actually goes to addressing the right healthcare goals, so everyone can benefit. This is particularly recognizable in some very high-spending countries that spending a lot of money on healthcare but not necessarily treating the patients. And some of these are not necessarily just in big countries outside of Asia, because we also have large economies in the Asia context. Okay, moving over now, how is this done? This is done primarily as in a healthcare without harm, have developed and nurtured the Global Green and Healthy Hospital as the network that primarily champions climate and health actions, both mitigation and adaptation. And it comes up from the healthcare without harm theory of change, that public health should be able to pursue and promote planetary health, whether by its own mitigation in healthcare impacts, or in the leading of broader transformation, collaborating with other sectors in the society, or creating community health and resilience. It should produce not only healthy people, but healthy planet. And GGHH is a global network present in 80 countries now, over 1,600 members. It is we have I think among us here in the audience are many members of the Global Green and Healthy Hospital Network, including Sister Arce, who will present her case of the St. Paul Hospital later today. It is a worldwide community of hospitals, healthcare systems, and organizations dedicated to reducing the ecological footprint of hospitals' operations and actively promoting environmental and public health in their communities. It is guided by 10-point sustainability goals, and for which I have already produced several guidance documents. The latest one, not in this illustration, is a guidance document on sustainable procurement. And these are the agenda of GGHH. I think Renzo at some point already showed this, but I just want to tell you in the context of mitigation action, whether it's water, food, pharmaceutical, building, everything else, it produces emissions. But the #1 thing that we value in transforming hospital is the leadership. And that's why it sounds odd that 9 technical sustainability goals and suddenly the leadership in the hospital. what drives change to sustainability in hospitals are enlightened and effective leaders. Now, I'm moving over now to measurement and tools, what we use in healthcare without harm to encourage, track, and actually reduce annual emissions from hospitals. And we call this the Climate Impact Checkup Tool, which is the Healthcare Without Harm Carbon Footprint Calculation tool. It has gone a long and winding developmental phases from 2016. It was in 2017 when we finally launched our global program on health and climate. But even before that, we're already trying to develop this carbon footprint. And then we tested it out in the succeeding years. We launched the carbon footprint calculation tool, which we call as the checkup tool in 2021. And my colleagues, some of them are in this room participating, have already trained uh, members of the GGHH, Ministry of Health, from across at least 5 countries now in the Southeast Asia region, the Philippines, Indonesia, Malaysia, Taiwan, and I'm forgetting another. And soon 2 others, Singapore and Vietnam. So this is a tool that is spreading out across the globe, adopted both by hospitals and ministries of health. And what is being measured, as going back now to scope 1, scope 2, and scope 3, it includes stationary combustion, mobile combustion, fugitive emissions, waste on site treatment, purchase electricity, travels, business travel by the hospitals, electricity transmission and distribution losses, inhalers, waste off-site treatment, employee commuting, and patient commuting. Now, we keep on reviewing and refining and recalibrating our climate and healthy strategy in healthcare without harm. Over the course of 6, 7 years now, I think there are already 3 major revisions because things are really changing fast. We haven't expected how much healthcare would be eager, take action, do advocacy, and do transformative work, both in its own facilities, in the MOH, and at the global level. Now, the tool is accessible both to the members of the GGHH and through non-members, and we can discuss this further during the open forum. Now, I will go to case examples based on the 10-point agenda. This is very quick now. By first looking at Kotikpat Hospital, how it harnesses the power of nature in providing healing. It is beyond traditional hospitals because it believes in facilitating healing using both what the medical science can offer and what nature do provide. KTPH use nature as a healing process through paying close attention to all human senses, including sounds, smell, whether it is the sounds of the butter or the view of the butterflies, the birds, or the fish in the ponds. These are all in our nature, and yet provides faster healing to patients. The rainforest landscaping, as you would see in the picture, it weaves in and out of the hospital and infuses the atmosphere with natural sights, sounds, and scents. KTPH, we're proud to say, is a very active member of DGHH. They hosted us in the 5th Global Green and Healthy Hospital Assembly held in 2019, just before the pandemic, in this very building. So we've seen this in action. We've seen their plants and fruits growing, vegetables over the rooftop. not in a way that is just a small quantity. It is even of the growth in their own agriculture on the rooftop provides food in the cafeteria, and there are more excess harvests that are being sold to the public that comes to the hospital every day. And then it also supports green design and construction. This is the Kotikwat Hospital in Singapore. It 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 harvests the waters coming up from the nearby lake and recycle it. It harvests the natural wind, the sunset, uh, and it again it's a holistic approach to green hospital. On food intervention, I can mention two or even three: the Buddhist Chuchi Dialysis Center in Malaysia, the West Java Mental Hospital in Indonesia. There is also the Chuchi Hospital in Taiwan, in Taipei, and also a hospital here based in Manila, the Adventist, that are growing food in their own facility and providing healthy plant-based diet among employees and patients. Again, reducing its carbon emission. I think I'll stop there, Renzo, because I could not wait any further. Of course, there will be questions and answers, but there is a case study that will be presented later on by Sister Arce herself. Thank you.
Thank you very much, Mon. That is a very rich presentation about the mitigation role of the health sector. You presented several useful frameworks. For example, the Global Green and Healthy Hospitals, several of Healthcare Without Harm's reports, and also towards the end, those fantastic examples that I hope our co-learners can learn a lot from and try to emulate. So we're actually very interested in hearing from our co-learners here. So far, what are some of the mitigation actions that you think you can actually easily implement in your respective hospitals, clinics, healthcare organizations, mitigation options that are, again, easily implementable, perhaps not requiring a lot of financial resources, because I believe that is usually the question, right? Can we actually spend for these climate mitigation, sustainability interventions in the health sector? So maybe, Mon, to start the ball rolling, you can comment on that perennial question around cost. Is climate smart healthcare, is low carbon healthcare, is environmentally sustainable healthcare expensive? Mon, initial thoughts.
Yeah, very good question. We are paying dearly for the neglect that we have done in our own healthcare setting, whether it is in management of waste, whether it is in use of the energy, whether it is in the use of transportation, such that now we are a major carbon emitter as a sector. It would have been, if we had known better earlier, for example, whether intervention on food, better waste management, or efficient energy use, then we could have saved much more money that not only can be reused or used up to provide better and more healthcare services, but at the same time would yield lesser carbon emission and lesser pollution that would not cause illness to patients again. So the issue of cost is tricky, because whenever we produce emissions, toxic emission, carbon emission, we are poisoning ourselves such that we become sickly. and therefore we become dependent on treatment by the hospitals. Whereas a healthy environment, a healthy society produce healthy people. That is the least, that is very economically cost beneficial if people remains healthy. So in many ways, it's even more effective and efficient to go green now than postpone it, because you will save a lot of money. And this is shown quickly on the issue of energy. Whether you just become energy efficient or you adopt solar roofs in your system, in a year you reduce 10 to 20% of your energy costs, the bills that you pay for, and then over time, you reduce it further to 20 to 30, and you don't become dependent on the grid. Therefore, investment is cheap and the yield is high in terms of sustainability in healthcare. And more hospitals are realizing it, and they're
Yeah.
shifting.
Excellent. And I think at the heart of this is a mindset change, right? That at
It
the
is,
top
yeah,
leadership, there has to be a conscious decision that from now on, we will be investing in green and sustainable practices and infrastructure. Because yes, and sometimes it may be costly at the start, but in the long run, you've mentioned that there are hospitals, for example, even here in my beloved hometown of Calamba, they are reporting savings being realized over time because their hospital bills are not anymore, fully coming from, let's say, or no, not hospital bills. Electricity bill is not fully coming anymore from, let's say, the electric grid. Part of the
exactly.
energies and energy being
Yeah,
used is already coming
yeah,
from the sun absorbed in the rooftop.
yes,
So that's one mindset change. And then you're saying also that actually we are under costing the entire thing because we're not calculating the diseases, for example, that are being
exactly.
being generated by climate change and air pollution and waste disposal, plastic pollution, so on and so forth. So if we internalize those costs, then actually the business as usual is going to be much more expensive
Very
than the
expensive.
cleaner options, which will prevent disease.
And I think this will be exemplified by the presentation later of Sister Arce, because they calculate savings in terms of monetary and then the carbon emission as well. And many hospitals in the GGHH network are doing the same. Uh,
Yep.
Both translating the savings not only in terms of reduced emission, but producing savings in actual peso terms or
Right.
monetary terms.
Right. And actually, I'm looking at one comment from one of our co-learners. Investing in green and sustainable facilities is costly, but if we consider cost-benefit analysis, it poses more benefits. So it's about
Exactly. Yeah.
monetizing, quantifying, having a full description of the benefits. And of course, the other challenge is communicating this to, for example, the hospital board or to your leaders, to your financiers, and even to your patients, right? Mon, do you want to add something?
Yeah. At times there is confusion here, because old hospitals are big carbon emitters compared to the smart hospitals that are being built new. Uh, However, how do you transform old hospitals that are 30, 40, even 50-year old? The literature is beginning to acknowledge that you just don't destroy off all the old buildings, but rather you refurbish, because by so doing, you save further carbon emission, because building new is also would produce uh, the supplies, the cement, the steels and everything, but using what has been established and refurbishing it would save you emission and money as well. So I can talk about this because this is the experience we're getting now in Thailand, where several hospitals are being built on top of already a developed uh, system. But the among the team, and we're providing the climate advisory, is an engineer who've been doing this business for many years of how do you make use of old building of hospitals. Just do not destroy at the onset. Study it because it will save you more money and it will also less carbon emitter rather than building a new one entirely on top. So and therefore that both the science and the philosophy of why go green and why go resilient and why go climate smart uh, should meet uh, in this particular instance. But there are simple ways. Waste
Right.
management. Hospitals have already been showing. You reduce even your plastic bottle waste. Uh, you save money on the hauling. You save money on in terms of recycling, and at the same time you transform the behavior of your own people
Mm,
on what is convenient, because
right.
convenient becomes an excuse, right? But people would realize later that bringing your own reusable bottle is convenient, not
Yep.
depending on the PET bottle. So yeah, as you said, it is the mindset, Renzo.
Yes, and before, since you already mentioned waste management, I want to actually move to other mitigation measures apart from energy reforms and, for example, changing, improving building design. There's one comment here: biophilic design, or design that mimics nature in healthcare settings, has astounding health benefits for all.
Exactly.
In improving the greenness of healthcare facilities, are also is certainly another option apart from the ones that you mentioned. But still, about cost, the other thing is that a lot of these green measures are in general already going down in terms of price. Solar power today is much cheaper than
Exactly.
10 years ago, and I think in some places, and it's already cheaper than coal driven or coal generated electricity. So I guess now we don't have really much excuse to ignore, for example, solar power, because cost overall is going down. um and then I think the other my other comment regarding cost is that there are already, and you may be aware of some existing mechanisms. There are already financial or financing options, right, for those who want to do green hospital work. Maybe you can share a bit of, are the banks already lending
Yeah.
hospitals to
Uh,
invest in green technology, for instance?
in our region, I can see the shift, for example, in the philosophy of the ADB in supporting health infrastructure.
Yep. Asian Development Bank, you mean
The Asian
ADB?
Development Bank. They are asserting that the climate smart features, when you conduct the pre-loan assessment, should already be part of the team that will look into the feasibility, and therefore part of the visioning of what is called in Thailand, for example, as medical excellence centers, would mean climate smart, meaning sensitive to the threat of climate in the locality, at the same time resilient, for example, against flooding, because flooding is a common concern as well in certain cities in Thailand, and would model what should be viewed as climate smart healthcare across the region. So that's the direction, and it's a very strong trend. We see queries from MOH, different ministries of health, on how this is being done on this place, how it can be copied, and how can it be fertilized. And now with the UNFCCC and the other health and WHO providing all the guidance as well, I think it will just accelerate. So not to take action is unimaginable because one, it is a health imperative, as we see the health co-benefit. Secondly, it is our own children's future at stake. So
Right.
we just need to do our action. But healthcare is a big demands a big leadership role, not only in the healthcare sector but across society.
Yep. And you already alluded to some hospitals already leading the way. And I think we can continuously reduce the cost of, let's say, solar or green approaches to healthcare waste management, etc. Or, for example, lower the cost of medical commodities that are made of sustainable products if more and more hospitals, health professionals are purchasing them, demanding them. That's the law of supply and demand, right? The more we purchase it, the more there'll be pressure for suppliers to actually supply more of the product and also to reduce the cost. So I think the lesson is we have to capitalize on the purchasing power of the health sector. If we can all come together
And
and
yeah,
buy.
and whether it is on light, the use of lighting inside the
Mm,
hospitals, the use of certain chemicals, the reduction of unnecessary plastic. Because there used to be a mindset that hospitals are exempted from this environmental prohibition, for example, the use of certain materials, simply because we are in the business of healing. And in the context, of, for example, of the current discussion on global plastic treaty, which is highly
mm,
a climate discussion as well, and very much a mitigation uh, conversation as well. Healthcare without harm has taken the position that we should not exempt ourselves from whatever treaty agreements that will come out from this. In fact, we should support if single-use plastic is eliminated in a particular setting, so it should be in the healthcare setting. We should
right.
provide that example, that leadership as well.
Correct. And you are already mentioning about the plastic treaty. You also referred to the WHO a while ago. There was a question about, or a comment rather, what we need are policies and standards forwarding the establishment of green facilities. So maybe you can comment on some policies that whether domestically or at the international level, that are really
Yeah,
driving
I
this.
hope there are participants here, for example, from the Department of Health, because we applaud them for releasing the what they call as the Green and Safe Hospital Manual during the years of the pandemic. I think it was in 2020 or 2021 that it was released. If you look at it, it talks about both greening and building standards of a hospital. And then now they're moving towards even putting it as part of the requirement whenever hospitals apply for accreditation every year. And when we study this manual, it is not perfect, but you will already see that there is this active acknowledgement that emissions should also be reduced in healthcare facilities. Now, there is also in Thailand what they have a contest or a competition among hospitals annually for 16 years now. They call it clean and green.
Mm,
And so hospitals would be proud displaying whether it's the certificate or the trophies, whether it is best, for example, in gardening, or best in water resource management, or best in healthcare management. But lately, that they added a new category, it is on carbon reduction in hospitals. So And then in Vietnam, there is a total ban of single-use plastics in healthcare, both for purposes of plastic pollution and climate mitigation. So, meaning across our region itself, there are policies that I would consider as progressive. Again,
Right.
not perfect, not necessarily being implemented well, but by the fact that it is already a declared policy, it provides the platform for us advocates to pursue them and make it work among hospitals.
Right. And I think this is important because, so for example, in places like the Philippines, but in basically every developing country in the world, there is a push to expand universal health coverage. And as we increase coverage of healthcare, that will mean more hospitals will need to be constructed, more healthcare will need to be delivered. And if moving forward, all such healthcare facilities will embrace, climate smart healthcare, then that will make a huge dent in, again, the improving or lowering the carbon and ecological footprint of healthcare. So it's very important to really embed this in policies. And there's a comment here: state policies play a huge role in implementing a net zero approach in conducting the business of every organization, including the health sector. Wow, this is becoming an increasingly rich conversation. I really appreciate all the comments. We have comments such as there should be tax incentives for hospitals to go green. And then we also have some examples being cited in the chat box. But we want to hear one concrete example this evening. And we are very privileged to actually have with us one of our strongest allies in the global green and healthy hospitals movement in the Philippines and in Southeast Asia. And we have here with us Sister Arcelita from the St. Paul Hospital in Iloilo. I wonder if Sister Arce can turn on her video and her microphone. Is she still around? And she will be presenting the case study of her
Mitigation,
hospital
yeah.
in Iloilo. Sister Arcelita Sarnilio, are you still here with us?
She was here already a while ago.
Yes, yes, yes.
And you
Okay,
are here,
yeah.
Sister Arce. It's a pleasure meeting you again.
Yes, Mon. And Renzo, good evening. Yeah, I'm here.
Excellent. So feel free to share your screen now, and maybe for around 7 to 10 minutes, you can present the amazing initiatives of the St. Paul's Hospital in Iloilo, hopefully to inspire our co-learners to do the same.
Okay, so just do it quick. Let me share my screen. So good evening, and I'd like to thank Mon for inviting me here to share on our initiatives towards climate change, climate mitigation. So I'll be presenting SPHI's initiatives towards climate mitigation. Just introduction to our hospital. We are 112 years old. Sorry. Anyway, St. Paul Hospital is a member also of the SPC Healthcare Ministry. So we have 13 hospitals in the country, and St. Paul's was the first or the pioneer among the 13 hospitals. And each hospital of the ministry has its own initiative for climate mitigation also. So being a member of the Global Green Healthy Hospitals, we are guided by the 10 goals of the GGHH there. And so now before I proceed, I'd like to present this slide. This was on February 17, 2023 from a visual capitalist, Mr. Rick Casono. that if you can see here, the Philippines is the highest plastic emitter in the world with 356,371 tons of plastic waste dumped in the ocean. Next to that is India, and then Malaysia. But the rest of the world, accounts only for 176 tons. So we could see that a small country like the Philippines can pollute practically the whole of the sea. So we have these initiatives. First is the strict implementation of the segregation or the no segregation, no collection policy. So we have here all our waste bins, paper cans, and everything. And then at the materials recovery facility, we do intensive segregation still, wherein we have the paper and plastic shredding, the glass and vials crushing. Then the plastic, the shredded papers are for sale, recycled. Then the glass vials are being used as a fine aggregate with cement. So when we have constructions, we mix the cement, the crushed vials with cement. We replace about 15% of the sand. We replace it with the crushed vials. And this binds very well with the cement. Also, another initiative is we have this project of works, Trust to Works of Art. So you can see these are lanterns that we had last Christmas, and these are all made of recyclable materials. So from that, we could see here in 2022, we had an income of 200,000 for the whole year. And until this time, as of May 2023, we had an income from our recyclable waste of 54,291. Maybe in dollars, that will be about $1,000. So during the pandemic, we were not ready for all these PPEs, but even then, had we use the PPEs, it will be very expensive for us, and the materials, the resource for the sources were also very difficult to find. So what we did was to make our own reusable PPEs. So we had this silver taffeta cloth sewn in our linen room, and even the cloth mask. At the start of the pandemic, we made cloth masks for our staff that we insert a surgical mask within the cloth so that we do not need to change the surgical mask every day. So we just wash the cloth mask, and then the surgical mask can be probably changed every week only for economy. Now just some so here, had we used the disposable PPE, which was cost at 800 pesos per piece, then this is a data from January to December 2021. So if we used disposable PPEs, we will be using 1,500 sets. So every month we'll be spending 9,600,000 all on all, 115,200,000 for January to December 2021. So, but because we only bought the silver taffeta cloth, we had a one-time expense only of 750,000. So a savings of 114,450,000 or $2,289. And also, if we had to spend for the collection of the hazardous waste, wherein one set of PPE would be about 250 grams. So per kilo, we're paying the disposable or the collection of the waste at 60 pesos per kilo. So if we use all those numbers of PPEs, we would have spent $41,000 or 2.16 million in pesos, equivalent to $41.5. Also, some of our initiatives is the use of electronic board instead of tarpaulin. So it's either tarpaulin like we have here and down, or in our TV monitors within the different areas of the hospital, we have the electronic billboard. And we also have the no plastic, no styrofoam policy. Then the shift from plastic to canned and glass bottles in the canteen, and fabrication of customized stainless needle cutters for the needles in the wards and in the emergency room laboratory. On water, we have ozonnated wastewater in our STP. This is used to flush toilets and water the garden. And we installed a water meter there in the STP, wherein we had a savings of 1,380 cubic meter per month, equivalent to 124,200 pesos per month. We also had the rainwater harvesting, wherein we had 162.8 cubic meter per month. And then the backwash water from the RO of the hemodialysis is utilized in the laundry. And we have the ozonator at the laundry department to disinfect the water. Now, on transportation, in our initiative for CO2 reduction, so we have this no idling policy for cars that are parking. And then we organize the Bikers Club among our doctors and staff. Right now, we have 120 members among our doctors and staff that promotes wellness and fitness, avoid exposure transmission to the virus during the pandemic. It's more economical if they don't need to spend for gas, and it promotes camaraderie among the group, and it's also reduced emissions. Right now, there are 20 employees who regularly use bikes as a transportation for work, and we have this computation. So this is a comparative CO2 emission between bicycle and car. This is a data from January to December 2022 with the 20 employees that to really regularly come to work. So that would be about a total of 651,050 kilometers. Now in CO2 emission per bicycle, we only have 21 grams per kilometer of CO2 emission. So that would be about 13,672,58 CO2 emission. This is just 7.78% as compared to the total. Because if they use cars, they could have spent 175,783,608 CO2 emissions. So if they had used cars, they would have made a CO2 emission of 92.22%. Whereas the ones who came for in bicycle, they only had a 7.78% emission, CO2 emission. And just very recently, last week, we have commissioned our the installation of our renewable energy. It's a 535 kilowatt peak. So we had here a data recorded of the 4 days monitoring since we started the commissioning of the renewable energy. So we had 1.41 tons standard coal saved. And then for CO2 avoided, 1.68 tons CO2 avoided, which is equivalent to 3 trees that have been planted. So this is only in plant number 1. We had 3 plants, no? So we only had this data yet we give this as an example, a data from plant 1. So we could just somehow calculate that times 3, then more trees and more CO2 emissions avoided. We are expected to save 600,000 per month with this project of the renewable energy, and that will be about 7.2 million pesos in a year's time. We have this contract with the timeless green in 15 years, so we can just somehow calculate how much will be our savings, because the rate of electricity here in Iloilo is very expensive. It's 11 pesos per kilowatt hour. Whereas with timeless green, we only pay 7 pesos. We already have savings of 4 pesos per kilowatt hour used. And we also installed energy monitoring device. So like, for example, we do activity-based costing in our charges and procedures. So like a tomotherapy at the cancer center, we only spent 61 pesos and 12 cents per procedure of the tomotherapy, as compared to the CT scan machine, which is 172 pesos or 10 pesos, 1,787 pesos per procedure. as compared to the 61.12 pesos only of the tomotherapy. So the tomotherapy is more energy efficient than the CT scan machine. Also with our MRI, we have here data. So the MRI has in a standby mode, we spend 3,268 per day in a standby mode only. So we can also calculate how much energy is, how energy consuming is the MRI machine. But of course, we need the machine for our patients. Now, we have already installed 100% of our lights for LED, and our aircon units also, we have 54% already aircon units with inverters. On chemicals, we substitute strong cleaning chemicals to environmental friendly and economical housekeeping materials like vinegar and charcoal as bathroom deodorizers, and baking soda and cucumber fruit for cleaning stubborn dirt and surfaces. Now, on pharmaceuticals, we safely manage and dispose of pharmaceuticals. We do close monitoring of stocks to avoid expiration of medicines, and made arrangement to return to supplies within 3 months to expiration. Then disposal of cytotoxic waste, because we have the cancer center. We do chemotherapy treatments. So we observe a delay to decay of 3 to 6 months for the cytotoxic waste. Then we support local suppliers to lessen carbon emissions on transport, because the farther the supplies come from, then more carbon emission is being consumed or emitted. And also we implement the closed pharmacy practice to avoid counterfeit drugs for patient safety. Now, as regards some other initiatives, the empty vials are sterilized and used for biopsy specimen collection. And medicine boxes, in fact, are recycled as medication cards, the white portion, the back part of the medicine boxes. And we minimize purchase of pressure metered powdered inhaler. We switch to dry powder inhalers, because again, this metered powder inhaler would have more carbon emission. As regards the anesthetics, we use sevoflurane over dysphorin anesthetic, because dysphorin has a 10-year lifetime in the atmosphere, 36 times the global warming potential as compared to 1.2 years only of the sevoflurane. So we do not, we only use sevoflurane in our operating room. On food, we plant vegetables at the SPSI, the parking area. We have the plant boxes there. And we also observe the meatless Wednesday and Friday program. So we know that vegetables, they are cooked faster than meat. On buildings, we employ skylight roofing to harness natural lights. We utilize bricks and pavers in some portion of the driveway and parking to neutralize the heat island. And we have operable windows for natural ventilation and lighting. And we have the greening of the hospital project, which promotes well-being and serves as positive distraction, aside from filtering the pollution within the hospital premises. Okay, and I'd just like to share that we have this Iloilo tree. This was planted on June 29, 2021. And we utilize placenta as an organic fertilizer from a 2-foot height. It's now 10.41 feet and high. And it's very robust. So somehow our initiatives were not in vain, because last December we received these awards from the Global Green Healthy Hospital. We have 3 awards for the commitment to the 10 goal achievement, and also environmental footprint reduction award on waste, as well as on energy. And in closing, I just like to quote Pope Francis and Laudato Si that climate change is real and urgent. It must be tackled. The clock is ticking and we need to act now, because we know whenever there are disasters as a result of climate, global warming, the climate change, it's always the poor who are mostly affected. So thank you. And Good evening.
Thank you very much, Sister Arce, for that very inspiring case study and also for those inspiring words quoting Pope Francis. Indeed, we only have one home and we need to take care of it. And the healthcare sector, such as your hospital, has a strong and important role to play. And I'm already seeing some positive comments in the chat box. There's one who was asking, can we get an invite to visit the St. Paul Hospital? Yes.
Sure.
You know,
we used to welcome really those who come to. We have received visitors from other hospitals, whether abroad or internationally or locally.
Amazing. I think, Sister Arce, your hospital is becoming now a tourist spot in Iloilo. I remember Mon and I were there during was it Dinagyang?
Okay.
Yeah, and when we held that workshop in your
in
hospital,
2020,
right?
yes, in 2020.
Yes, and we missed our flight because that was at the height of the festival. And we encourage everybody to learn more from the St. Paul Hospital's experience. So we can spend a few more minutes for discussion and comments. And I think what's interesting is here, you saw an example of an existing hospital. There was no major building that was constructed, but they made use of everything that already exists to reduce the carbon footprint and the environmental impact of the health facility. It's 116, correct? 112-year-old hospital. And whether you're a young hospital or an old hospital, you can make a difference. That is what we're learning from Sister Arce's experience. We can have more questions from the chat box. Someone also commented about your initiative regarding transport, because oftentimes when we think about improving the environmental sustainability of our health facility, we only think about what's happening inside the building. And you showed to us that we should also think about, for example, transport, because it's something that happens outside of the hospital's vicinity. But we know that patients and staff will need to reach the hospital. And therefore, we're extending our environmental sustainability responsibility to what's happening outside. So and you were able to show some very compelling numbers on how the carbon footprint of travel has been dramatically reduced because of your biking initiative, among others. Any other comments or questions? And Mon, do you have anything to add from Sister Arce's case study?
I heard new things again, Renzo. I'm really impressed every time I listen to Sister Arce making presentations, because new dimensions are coming into greening. But I just want to cite, in terms of transportation, the encouragement for the hospital staff, including doctors, to use bike going to and out of the hospital. I have seen a case of a green hospital. This is in Washington State, though. But just to drive the point, Mr. Arce, of what you started, hospitals issued bike free to all employees. And then part of the performance evaluation of the staff is how much mileage do you put into your bike every month and then up to the whole year. Pre-repair, there is a repair shop within the hospital. And then they link it up with the city, such that if you cannot bike anymore that far, there is a bus that will pick up your bike, such that you can still go home, partly by bike and partly through public transportation. So there's also an advocacy part of it, such that sustainable transportation is carried out by the hospital and supported by the city. And just to ensure that people are rewarded, they make it part of their performance evaluation. So,
And this-
Mr. Arce, congratulations
Yeah.
for taking this
Yeah.
on. I think many hospitals will learn from your great work on
Uh,
encouraging good health through biking for your own medical staff.
And by the way, Mon, I'd like to share that just very recently, our doctors have somehow imbibed the advocacy, and they have organized the HEAL program, or the Health for Environment Advocates for Life. This is initiated by our doctors, and they're the ones planning what more can be done for the environment. Even they suggested to have an after work walk. In at 5 p.m. after the clinic hours, they will be jogging or walking along the esplanade, and then they will be picking, as they said, they will be picking some garbage as they walk along, if they see around in the esplanade, especially within the uh, seaside. And
Wow.
during the Earth Day, our doctors and staff, we also had a coastal cleanup, and were able to gather 271 kilos of garbage within the coastal area.
Yeah, on this point, I just want to make a comment, Sister Arce and Doc Renzo, that the work in transforming your hospital, both in mitigation and adaptation, certainly will impact the community. It will model a way of both running a business, running a hospital, and promoting health in many ways. Because by biking and by your many actions, putting up you're greening the entire facility, you see the health value of it as well, and therefore it becomes a component of the work of building resilient and climate smart healthcare to later on act with and engage local government.
Yes.
And I think in many ways, thinking about the crisis, that should be a deliberate action. We're not doing this for our own sake, for our hospital sake alone, but for the larger community and to influence other hospitals and the rest of the city and other towns in your province. So
Right.
again, congratulations.
Yeah. Mon,
Thank
I
you.
remember in one of your slides, you mentioned that it's not enough that we actually do the changes within our own backyard, within the
Exactly.
hospital, within the clinic. We need to reach out to the other sectors, to the broader
Exactly.
community. We
Yes.
need to be the role model for the rest of society. And Sister Arce and St. Paul Hospital is just showing how it can be done, right? At the level of the city in Iloilo City. And I hope that many of our clinicians here or hospital administrators in the platform, in the Zoom platform, will emulate that example. So yeah, it just speaks to the leadership role of the health sector. There are a few comments that I want us to address. So one is, and I'll try to summarize, there are at least two questions that pertain to this issue. How can we strike a balance between ensuring environmental sustainability within healthcare versus promoting and protecting patient safety on the other hand? So there's a question regarding, the cloth masks. There seems to be evidence that maybe it's less effective in trying to prevent, let's say, the transmission of the coronavirus. But it seems to be the more environmentally sustainable option rather than single-use plastic masks. So how can we strike that balance? And Sister Arce, maybe you can draw from your example.
Well, of course, because Renzo, if you have to look at the disposable mask, except probably the N95, essentially some of the ideal. And in our case, I do not say that they just use all cloth masks for to all our patients. If they are really COVID patients, then of course we have to use the N95. No, we have to also protect the safety of our employees. But then, if we have to see the disposable mask, so very thin, whereas if the cloth mask, and if you really sort of tighten it, I really suppose that it's more practical to use and even safer. Because some people, in fact, I myself, I'm allergic to the fibers in the cloth mask. And I've been since the pandemic until now, I'm using just really the cloth mask.
Thank you, Sister Arce. And I guess what you're hinting at is we do not just, you know, implement something in a kind of a blanket approach. We need to really study the hospital operations and see,
Yeah.
okay, these are the sections of healthcare delivery where these measures are more appropriate. And then
Yeah.
there are some sections where, you know, for example, we cannot go away from N95, right?
Yeah.
And you know, I would like to encourage everybody here. We need to really study our respective healthcare organizations and examine each clinical care pathway and see where the areas for you know, implementing environmental sustainability practices are most appropriate. So it's not like a cookie cutter approach, right? We need
Yeah.
to be very specific and detailed.
Uh,
Sister
like,
Arce?
yeah, for example, in the use of the PPE, at the start, really, we encountered a lot of resistance of the doctors themselves, no, because they saw the disposable PPEs and everything. So I have really to show them, okay, doctor, I will put this under the faucet. If the water, if it's permeable, then I will not use it. But so I really test some sort of water test in the tapita cloth, and they saw that it is not it's not permeable. So they now have accepted, and they've been doing it also using the tapita cloth themselves. Yeah.
Thank you very much, sister. I'm trying to look at other unique questions because some are quite interrelated. Well, there's one specific question on how do you dispose your used face mask. Maybe you can talk a bit about your healthcare waste management practices
Yeah.
as well. In general.
I forgot to share in my presentation that we have 2 autoclave machines in the MRF. And so all our hazardous waste are being autoclaved before we dispose of it in fact, the general waste.
Right.
Yeah.
And it, you know, what the lesson that I'm gleaning from that is you're really investing in technologies, for example, that autoclave and you know, the other technologies that you have. And so if there's a will, there's a way, right? And really that's what you've been doing. Any other additional thoughts, Sister Arce, Mon?
For our water, yeah, another thing also is that for the water, no, Mon knows about this. We're not using chemicals like the sodium hypochlorite. The ozonator, we are using a high concentration oxygen to disinfect the water. And quarterly, we have the water analyzed, and it gives a better result, in fact, than the DNR acceptable range. The water is clear, so that's why we can use it really to flush the toilets in the doctor's clinics, huh?
Yeah, Renzo, just a point apart from the mask, because there is this pervasive dependence on mask. And then the other item is gloves. I think I already mentioned this. But in the same way that we should discern when and how to use mask in every place in the hospital, same is true for the gloves, because it also contains potent toxic emission that penetrates the soil and the ocean once it becomes waste. And the study in Healthcare Without Harm shows that a typical doctor in the time of COVID would use 10 pairs of gloves in a day, and yet half of it is unnecessary. If only there is a prior consideration of not only the cost, but the environmental impact that such reckless dependence on just covering yourself against the virus, and never mind how it will impact the rest of the society. And that's where we are now, the huge PPE waste that we have generated. Yeah.
Yep. Awesome. We haven't really discussed that much food within healthcare facilities, within the healthcare sector. And a few sessions ago, we had Dr. Lin from Taiwan. I believe he's also in the Zoom now. who spoke a bit about what they're doing in Taiwan, in the Dalin Chuchi Hospital. You know, they're growing their own vegetables in the backyard. They're serving it to their patients and staff alike. You know, he's even the president now of the Vegetarian Society of Taiwan. How can we do that, for example, in other places such as the Philippines? Are you already starting some initiatives around food within healthcare? Sister Arce?
Yeah, as I mentioned, we have planted vegetables in the plant boxes in the parking building, and we use it in the canteen and the dietary.
So
Yeah,
yeah,
food
you're
is,
already doing it. And Mon?
I hope Dr. Lin will turn on his microphone in a while. But food is an important dimension of reducing the carbon footprint in the healthcare sector, as being proven by several hospitals already here in the Southeast Asia. But in 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 GGHH members in other parts of the world, in the US, for example, there is a huge food program that one transforms procurement, transform food habit, improve improve health by relying on a plant-based diet, that also change relationship within the community, because now you're tying your healthcare food system or food supply from your local growers. So it has its own economic impact as well,
Benefit.
and it encourages organic farming. So
Brilliant.
the link to the overall work on greening and transforming society to one that is low carbon, food is vital, and a hospital should play a role in this. And there are
I really
already many good
appreciate
examples of it. Yeah.
Yeah, I really appreciate, Mon, that you keep on repeating the importance of healthcare leadership in broader societal change, you know, whether it's in food or picking the garbage in Iloilo or trying to influence policy making. And even you mentioned sustainable procurement. You know, we should be the leader in sustainable procurement.
Exactly. Yeah.
You know, maybe Sister Arsa, you can just share a bit about how you're putting in place sustainable procurement policies in St. Paul. Is it something you're already working on, considering for the future?
Yes, we have started actually, because we have participated in the SHIP program no. So actually in our purchasing, we are accrediting the suppliers. So we have a continuous, and we evaluate also the suppliers. And in fact, we also encourage them to observe waste management, like we don't accept, or we return to them the plastics wrappers. No, when they deliver the goods and then it's wrapped in plastic, we return to them the plastic when we put the boxes.
Do they accept it?
We advise them to really minimize the use of plastics. And in
That
fact,
in a way is already a push. Yeah.
I have talked to some suppliers already, because I know of this expanded producers responsibility month. So
correct.
one time I discussed with our supplier for these blood bags and the blood sets. So I thought, can we implore or already implement the expanded producers responsibility, because it's already a law now. So still, okay, we can think about it on how to be the mechanics, no, because there are also sort of laws how to dispose of those.
That's true.
Yep.
True.
Yeah.
Okay, well, it has been a very rich conversation, and I think a lot of our learners here are so inspired by the example of St. Paul Hospital. Please expect, Sister Arce, more visitors to be coming to Iloilo in the coming weeks and months. And of course, a lot of our learners are very interested in Healthcare Without Harm's materials, and we encourage everybody to visit the website of Healthcare Without Harm, the website of the Global Green and Healthy Hospitals, because all the materials, the case studies, the tools are there. And maybe I'll just ask for some final words of encouragement from both Sister Arce and Mon before I wrap up this session. Let's start with Sister Arce.
Yeah, usually because many would say that to observe the waste management and all these initiatives will be costly to the hospital. But then I would say that in our experience, in fact, we save from that. It's not really, I mean, it's really a matter of thinking or the implementation, because I do not see it really as a big expense on our part. And as I said, we even save from these initiatives.
So we save our patients, we save our planet, and we save our pockets as well.
Yeah.
Exactly.
Right.
Yeah.
And then Mon, I give you the last word.
Yeah, I just have to thank this course for providing the platform to discuss this work further in a bigger audience in Southeast Asia, and some are even international. But I think it's becoming quite this imperative that the work on climate has to happen now, regardless of which sector do you belong. But healthcare is even an imperative because we promote health, we provide healing. We we were trained to heal patients and to treat illnesses, and therefore we cannot just uh, externalize how we've been damaging our environment and destroying our climate, uh, that are now is threatening us in a daily basis. We live with the impact already of climate change. And yet, as noted, exemplified by Sister Arce here, and as I've shown in many slides, the actions are within our hands. It's not expensive, as already mentioned. It's not impossible. It even would bring in unity within the bigger society, and it transforms mindsets and behavior of people within your own facility. I can cite more, but we run out of time. So, Renzo, this is a work that should be done yesterday, but it's a work that should be continued. And network is important, just like what Sister Arce has been sharing. And anytime you invite her, she will just be ready to share and share. Uh, we just need to encourage each one and transform our society to something that is hopefully better, more livable, and healthier. Thank you, Renzo.
Thank you so much, Mon. And yes, I agree with you. We really appreciate Sister Arce's always on the go attitude. Every time we invite her, she has new things to share with us, right? And it just shows that their initiatives in Iloilo, in St. Paul's, are continuously evolving. They're very consistent, and they are very committed to continuous improvement. And I think that's also another important lesson. It's easy to start, but usually to sustain the momentum is very difficult. And if we want to succeed in this cause, in this advocacy, we have to have consistency and sustainability of actions. And so again, Sister Arce, we are very grateful for your positive example. And of course, Mon and Healthcare Without Harm, thank you for your leadership in this campaign. Of course, next week on Tuesday, we have the part 2 of the Climate Smart Healthcare content of this course. This time we will focus on adaptation and resilience. How can we make healthcare adaptive? The last sector standing when climate-related disasters strike. And so we will learn more about that. And again, a kind reminder to our co-learners, you are on session 6 out of 8 sessions. Please don't forget the last 2 sessions next week in order for you to get access to the post-course survey. So everybody's asking, where is the survey? The survey is going to come to you next week. and then you will only get your certificate after you have finished 6 out of 8 sessions. And of course, all the session recordings will be available online on the YouTube channel of the Global Consortium, on the website of Columbia University's Mailman School of Public Health, and you will also receive them through your email. So please be patient, but also see you next week during the last 2 sessions of this Southeast Asia Climate and Health Responder course, brought to you by the Global Consortium on Climate and Health Education, the St. Luke's Medical Center College of Medicine, and of course, Healthcare Without Harm, Southeast Asia. Good night, stay safe, take care, happy weekend,
Yes.
see you next week.
God bless
Thanks again,
us
Sister
all.
Arsen.
God
Thanks,
bless.
Mon.
Thank
God
you,
bless. Thank you.
Renzo. Thank you, Mon.
Thank you, Renzo. Thank you, Sarah.
That's
Thank you,
it.
everyone.
Thank you, everyone.